I always like to say, if you're the smartest person in the room, then you need to leave that room and go to a different room.
Okay, greetings. We are live and welcome to another episode of formerly known as Information with Deidre. So, this is actually the very first episode. We are shifting a little bit because we have been a little bit more inclusive in the recent videos of people who don't necessarily have MPHs, right? However, their careers are just as relevant and have been, really connected to public health. So, what was Information with Deidre Public Health Career Spotlight is now Masters of Health. And we are talking to all people, even those who have been with us, interviewed in the past and going forward. They are Masters of Health because the things that they do deeply impact and greatly impact in a positive way the movements and the flow of public health. So, our guest today, I'm so excited, her name is Chidi, and she is a venture capitalist. And so, we're going to go through some of those because what we've been doing is really highlighting people who are in the field, very related to a lot of clinical work. But what Chidi does is very different. It is focused on investing, right, in the public health field. So it's bringing that business side to public health and showing you like that well-rounded view of what's needed to keep things moving. So I'm going to ask Chidi to introduce herself, tell us what you do, and a little bit about your profession.
Thank you very much, Deidre. So my name is Chidi Nwankpa. I'm originally from Nigeria. I'm currently working as a venture capitalist in the United States, San Francisco to be specific. And what I do is to invest in early stage companies, mainly within healthcare, but also focus on other impact sectors such as climate change and labor automation. So very interesting to speak with you today, and I would love to really dive more into the field. But just give a recap about my background. So I graduated with my MD degree from the University of Benin in Nigeria. I worked for a couple of startups as well as a family medicine physician. I'm in the US as well as in Nigeria prior to getting my MBA from University of Chicago. Post MBA was when I moved into the VC field. So it's been a long journey, but I'm excited to talk more about this.
Great. So normally in this situation, I would ask our guests, like, well, what field of public health does your career cover? But being that you are on the investor side, you cover a broad range, as you shared. There's climate change. You and I spoke before. There's labor. There's definitely the direct connection to health, medicine, and public health, and all of those. And even though you may not think like labor, how's that? It's all related because especially if we're moving in this world of where we're focusing on social determinants of health, we know that things like the job market, people having jobs, adequate housing, all of those things matter and they do affect public health. So that's why this was really important to kind of bring this aspect, this investing aspect, to light and let people know that these exist. So tell us a little bit about how you got into investing and why, and like why you felt it was so important.
Definitely, I think just to put shed more light into the reason why I moved into investing space. So after my MD degree, I worked as a family medicine physician, like I said, and then I worked for a couple of startups. But what we found out while working for a startup was that having grants and charity and philanthropic donations was very beneficial for startups in the very early stage, so 1 year and to about 3 years post founding. But after that, it was just not sustainable. So we were having a lot of issues with startups that were coming up in the space, in mainly within the African ecosystem, but were dying just because they were one, they were not sustainable, and two, was very difficult for them to get investors. And I think the reason why it was difficult to get investors was that there's not a lot of people within the investing space that understand public health, I understand global health, I understand things that affect people in marginalized countries, developing nations, and also people that have inequality to health access. So I felt like it was very important for someone with my background, knowledge of public health, knowledge of global health, and also the combination of my finance skills to come into this space and try to change it. And that was the reason why I decided to move into this space.
Okay, great. So another thing that's really interesting, Chidi and I met on Clubhouse. And so she's really taken her skill set and moved it toward public health. So yes, like you like you said, you originally come from this clinical based background as an MD, like you're a trained MD. And then you've taken that and kind of moved it into the business sector, and then you find yourself like, this is public health, it's like that middle road between like, how do we help like the clinical side as well as the prevention side, which is public health and health promotion. And so also, in addition to being a venture capitalist or healthcare investor, Chidi is also the founder of the Global Health Partners, and also the founder of the Global Health Group on Clubhouse, which has over 10,000 followers. I know because I was there at the celebration. It was awesome. So tell us a little bit about how, your movement, like currently, has really kept you motivated.
Definitely. So I'll tell you a little bit about why I started the Global Health Club on Clubhouse. And so this was back in when Clubhouse was really in the founding stages. There were a lot of rooms on the medtech room was a big hit. There were other rooms on healthcare startups, healthcare innovation. But what I realized was that there was just no room that was focusing on public health, on global health. So you had a lot of people talking about innovations within cardiotech, innovations within neurotech, but there are not a lot of people talking about things that I felt were very important to people that don't have access to healthcare. So health equality, issues happening in developing nations, hunger, food hunger, crisis, and all of these issues that I felt like were very important to be said. So I decided to found the Global Health Club. I'll admit I didn't expect it to get to about, so we're currently about 11,000 now, but that was not my expectation. I just really started it because I was very passionate and I wanted this information to come out. And so now that it's really taking off, it's been very exciting to see how a lot of people are interested in this space. So I'll just tell you a bit more about one of the rooms that we hosted. So Sonny and myself, who is my partner, and we hosted a room where we actually had someone live from Somalia talk about the situation in a hospital in Somalia. And it was a very passionate moment where we were listening to someone, and at some point, the connection cut because he had to leave because he was called for an emergency. And just having that kind of interactions in your apartment in San Francisco, listening to someone in Somalia talking about what is going on live, I feel like that is a very great opportunity, and is a very great way to learn more about what is happening outside of your surrounding. And
Yeah.
so those are the things that motivate me a lot. I'm very motivated by the fact that just having your own little impact in the world. I don't think we can change the whole world, but I think if you can educate someone that probably has never been to Botswana, has never been to any part of Africa, or has never even been to McAllen, Texas, which is
Yeah.
where I practiced for 1 year, and you go to those kind of places and you realize that there are a lot of people that don't know the situation within these spaces. And if I'm able to tell people about this, if I'm able to get some people more interested, if I'm able to get some investors to think about this space and invest their dollars into this space, then that's something that's very motivating to me. And I'm very happy that so far it's been a great hit. We've had a lot of people reach out saying, "Oh, I didn't know that this was the situation in this country. Now I'm very much interested. I look up things about the country, and I would love to donate something somewhere." So if this is just one impact I can have, that's something that is very passionate to me.
Great. So, as a trained clinician and also someone who is very familiar with, developing nations, can you give our viewers, because and this is, going to premiere live, and so people are going to have a lot of questions. So, this interview, so full disclosure, is actually being pre-recorded. So for all of your questions, definitely share them in the live, and so as we see them, we'll be able to get to them and answer them as we can, and you can share them in the comments below. But one question I have for you regarding investing, right? Because that's what I want to make sure that we get to. In your experience, what are some of the areas that you have seen are the places that need the most investing? Like, if you can give us like a concrete example of, like, even if it's like the startup that you were with, like, what are some things? Because, I know we talked broadly, you mentioned about there's water, labor, food insecurities, but what is an example of, something that someone could be interested in investing in, or and even taking it a little bit further? What are some of the best areas when we're talking about investing in public health? What are some of the best areas that people can start thinking about and wrapping their heads around and, like, kind of paying attention to on the market?
Right. So when I think about investing in public health, I really think about it in terms of two broad areas, right? So there's the communicable diseases and infectious disease, which is what everybody knows in about public health and developing nations. But there's also the very increasing burden of non-communicable diseases. So a lot of people are now coming down with things like diabetes, hypertension, cancer. So these are all big killers. And so if I was going to pinpoint areas where you could start thinking about investing, and then also expecting returns because that's why you invest, right? I think of two main areas. I think of prevention. So like what are the things that can help to prevent things? So if you have fitness apps, fitness startups, that could help to prevent obesity, help to prevent some things like obesity, diabetes, hypertension. Also, you're also thinking about other prevention measures like vaccines, which are all big companies. So obviously not for the small man, but these are all areas where you should start thinking about. And then also, I'm also thinking about even more moving away from prevention, but diagnostic as well. So, like, how do we get low cost diagnostic devices? So, we know that a lot of devices that can be used to diagnose most of these diseases are very expensive. So, you can't have access to them in developing countries where there's probably just one hospital serving over 10,000 people. So, if you can have startups that are looking into making low cost diagnostic devices, so that devices that are portable, that can be transmitted from one place to another, so you can share those devices, and as well as are low cost. And these are things that we're looking at in terms of saying, okay, yes, you can actually sell in the US market, which is where you can get premium prices, but you're also going to be able to get some of the dollars from developing nations because they need these devices. And if it's at low cost plus, then you can actually ensure that you get this huge number of people that are purchasing these devices to be able to cover up for the investment you made in the initial investment in starting up the company. So these are the things we're doing. Obviously, there needs to be some fine tweaking of most of your business model. You can apply the same business model you have in the US, in Europe, if you're going to go into developing nations. But once you're able to fine tune it, understand how countries within these spaces operate, then you get this huge market size. So you have this high addressable market. So you're no longer restricted just to the market in Europe or the market in US, but now you have this huge market and you can actually start tapping from emerging countries like India, like Nigeria, which are all big markets. If you have a product that is less expensive relative to the current modalities.
Yeah. So two things, like, thank you so much for sharing that. Two things that came to mind as you were speaking. I was like, when you talk about like diabetes, hypertension, like these are things that at least in the US specifically are already like comorbidities that are experienced by especially specifically like people of color, even more specifically black people or African Americans. So are you, what I was hearing is, are you saying that these are now issues that are becoming more prevalent in developing nations in on the continent in Africa?
Definitely. So now we're actually seeing more deaths from people with non-communicable diseases, other than previously when it was more likely infectious disease that was causing mortality. And I think the reason is multiple folds. One is that people are living relatively longer than before. So like the longer you live, the more predisposed you are to this kind of chronic conditions. So that's one. Also, there's also the increasing adoption of the Western diet. So there's apart from Western diet, also the Western way of living. So now most people have cars. Most people, before we would probably have people going to the farm, but people now have white collar jobs and they have to go to work, and then you have the sedentary lifestyle. So when you add all of this combination, and then you also add the factor of being in a developing country where you probably don't have access to healthcare providers. So you're not going to see a healthcare provider every year to do an annual exam. You only go when you're probably very, very sick. And so all of these contributors now come in to bring this double burden of disease where you're having people dying of obviously the apparent ones like tuberculosis, malaria, cholera, but also people also getting cancers and diabetes and hypertension. And so when you add all of these things together, you have this very, very bad epidemic where you're having people with poor healthcare conditions now
Yeah.
having infectious disease on top of that. So, like you can imagine the outcome of the severity of the outcome of this
Yeah.
combination.
Yeah. And so the other part that I wanted to ask about that came to mind while you were speaking. So I caught two things that this is for two things that would be like good maybe points of interest for people who are interested in investing or like finding points of entry to invest in public health care. But it seems to be like more on the clinical side, right? It affects public health, but it's more on the clinical side. And that was like, pharma investing because of vaccines, which we know, like, I'm sure like there were plenty of people who invested in vaccinations, especially given the last like 19, 20 months. And then also, like you said, the medications, because we see these comorbidities rising in countries on the continent. And the other piece, so there's pharma, and then the other one was the, like, as you said, the diagnostic. Would you say tools, like that? So it's kind of like technology. Um,
Exactly. Hmm.
okay. So for people, so let's like lay it out. So areas of interest or points of entry would be pharmaceuticals, and also diagnostic technology. So those are the areas that could be like really interesting points of entry or places for you to look into when it comes to investing. I had a question like based on that, like so maybe like a third point of entry, because again, public health is about like preventing disease, promoting health, and prolonging life. So in the same way where we've had so many like we've kind of been down that gamut in countries that are in the West, like, well, we have pharma that is like very allopathic, right? We have the established medical system. But would it be also like a point of entry to have like people who would like to invest in programs that help to prevent these diseases, so they actually provide education to the people so that they don't get that place, because we're already kind of at that space in the US. We're looking at social determinants of health and why people have certain diseases, like what their communities are doing, how people move and behave. And so it's like, well, we have to catch people at a certain point so that we shift the behavior. So it's like social behavior change. So could that also be a point of investment? So people creating programs and getting investors to, support their program to provide preventative programs.
Definitely, definitely. You really hit the nail on the head. And one of the things we like to say in venture capital world is that we don't know the future. All we can just do is identify something that looks good, right? So we are open. Like even though I mentioned these two different fields, these are just places that I've explored more and really dug really more into. But very open to seeing other business models, other ideas, and we do believe that entrepreneurs are the founders. They're really the ones that drive this industry. They move the industry, and they're all we're doing is just to identify, okay, this makes sense. This is a good business model. There's a potential in this company. And so once you have your idea, I think don't try to limit it to something that is just that fits into one of those buckets, because like there's so many opportunities, probably many things that I haven't thought about, many things that most people haven't thought about. But if you're able to bring something like that to future, so for example, even this show we're doing, this could potentially be a very good investment where we're seeing that, oh, okay, more people are listening to this show, we're getting viewership, and then it makes sense for us to invest in the company, and then we're going to invest in the company. So I'll say, there's no limit or cap to what is exciting. Just that these are the ones that have been explored for now, but like very open to other areas and interesting spaces that other people can come up with. And I always like to say, if you're the smartest person in the room, then you need to leave that room and go to a different room. So
Yep.
I'm very open to getting people that are smart coming to me to tell me about their different ideas. And all I can just do just use my experience and based on the experience I have as a clinician and also my business experience to say, okay, this is probably going to make more sense for the company, or this will probably work better for the company. But that's all I do. Like, the entrepreneurs are the smart ones that come up with the ideas and give it to us, and then we decide if it's something that we want to work into.
And so that being said, can you tell us about the day in the life of someone who is a venture capitalist in the health field?
Wow, that's a very interesting question, and I'll say that there is no day in the life of a VC. You're almost, and then obviously the pandemic has really changed everything. But the one of the things that really drew me to this field was just how dynamic and exciting it was. The only thing you need to do when you wake up in the morning is just be prepared for the impossible to happen. So sometimes I wake up and I check my calendar and I have no meetings, and then all of a sudden, in the span of 10 minutes, I have like 20 meetings. Now I have to be on Zoom for the whole day. And so, but I'll just talk about pre-pandemic and maybe probably, hopefully, post-pandemic, what VC usually is like. So, with as a VC, what you're doing is you're sourcing for deals. So that essentially means that you're actually actively going out to look for good opportunity that you think fit into your company's thesis or maybe your own personal thesis. So that could be attending demo days, attending conferences, trying to schedule calls with some founders that you think are operating within your space. So in my own situation, I will be founders within the healthcare space doing things that are exciting to me. So trying to target the rising cost of healthcare, target people in developing nations. So these are the people I'm actually actively looking for. So you can send cold emails, cold outreach, reach out to them, call them. So whatever you have to do to get that, that's something you have to do. And then the second part of the job has a lot to do with research. So you're spending a lot of time going back to the drawing board, understanding why this drug will work for this particular illness, why this drug will work for the other kind of illness and not work for A or B. And then you're also looking at maybe diagnostic companies. So does this device make sense? Is this something that is needed? How does this improve on the previous or current modality of diagnostic? So all of these things are all involved in the market research. Then after the third part of your job is also supporting portfolio companies. So once you've decided to invest in a company, they're now part of your portfolio company. A startup is going to experience problems along the way, and sometimes the problems come in bulk. So what you're trying to do with most of your company's founders and other management team is to make sure that you're understanding what are potential problems that could arise based on regulations, issues like regulations, issues like ethical issues, AI, so all of this potential competitive competition, mergers and acquisitions. So all of these components are things that you're doing on a daily basis. So you're attending board meetings, you're observing board meetings, you're speaking with founders, you're trying to understand what is happening within the space. So it's not just about investing in a company, but also you have to keep track of the industry to make sure that there's no new competitor or new entrant that could potentially disrupt things or could disturb the dynamic you've created. So it's all of these things, and in a very long-winded way, the very short form is that there's no day in the life. It's just a lot of things coming together. So I think the skill sets that you need to operate well as a venture capitalist is really being very spontaneous. So you can't be focused on structure. Quit is kind of difficult for a lot of people. Most people like to have structure. They like to know this is what I'm going to do for this morning, or this is what I'm going to do this afternoon. But if you're a VC, you have to be very open to changes and I'm open to like things just happening on the fly and you quenching fires just as it's arising. So I think that's a skill set that you need to be a VC. And also, obviously, you have to be a people person because you're spending most of your day talking to people, if founders, potential investment opportunities, even teams, doing some clinic due diligence for your company. So like you're spending almost about 70% of your time talking to people, just getting to understand the feel of it. So these are all the nutshell way day in the life of a VC.
Yeah, that actually is really good because it answers like one of the last questions, which is like, what advice would you give to someone who is coming up, MPH or otherwise, in this case, who is interested in being an investor in healthcare or venture capitalist? And basically, it's be flexible. That's what I'm hearing. Be flexible.
The advice I would give for an aspiring VC is an advice that I think I don't know if this advice really helps people. So for you to be a VC is very challenging. First of all, getting into the industry, we know the story. It's very difficult to get into the industry. So that's one. But I'll say you have to understand how to leverage a network, and I think that's the most important thing for you coming to the VC because yes, apart from the obviously the being hardworking, which are all the cliche things. Obviously, if you want to do something, you have to be hardworking, you have to be passionate, but also very important to understand how to leverage a network because some of the people I speak to are people that I probably knew about 20 years ago. Yeah, you have to reach out to people. So how do you make sure that every single person you're meeting along the way is a potential network? You have to be look for how you can help people. So there's a saying that they say in VC world, you need to put yourself out there and help people before you ask for help. Sometimes you have to do some free work, you have to do some free sourcing for companies before you even get them to even speak to you. So
Yeah.
if you're interested in the VC space, reach out to people. Don't be ashamed or afraid to cold call people because you're
Call.
never gonna know. People are never gonna know about you unless you do all of these things. And I think, for me, that was one of the hardest things for me to do because if you come from the culture where I come from, you need permission to call people. You need permission before you send an email. So like it was very difficult for me to realize that I can just shoot this person an email or a DM. And then there's a lot of this information outside. So like most people's email are public, but you don't want to do it because you feel like you're probably disturbing. And I think most people in the healthcare sector and public health, we tend to be more introverted and a little bit more hierarchical. So like we want to make sure that we're doing things the right way, and it's very very important for you to do things the right way. But you have to learn how to put yourself out there. So like, how are you putting yourself out there today? Who are you talking to? How are you coming on Clubhouse? Are you a listener? Are you coming to interact? So for example, the only reason why I'm speaking with you today is because you came up to the stage when I started the room. So these are the things you have to do, and it's difficult, and I think it takes time. But the more you put yourself out there, the more people know about you, the more you become wanted, the more you become valuable to startups because now you have this network that they want to tap into. So that's my main advice: put yourself out there and leverage a network.
Yeah, that's awesome advice. Somebody very wise said, know how to work a room. And that was said to me not too long ago, pretty recently. So it's like leveraging that network is knowing how to work a room. So give thanks for that. So, my final question: what would, as a venture capitalist or health investor, what could a potential a startup or company or someone who's looking for investors, what could they do to make them attractive? So that's kind of the other side. We were asking more questions on like, what to get into on the investing side. But for someone who is like starting up a company or a program, let's say it's not, some sort of new device. So what are you looking for that makes a company interesting and something that and viable, or something that you would view as viable to try to sustain?
Right, that's a very good question. I think that I'll go with the contrary view, right? Because most people talk about the market size, people talk about the team, and these are all very important. You need to have a good team, you need to have a good market. But I think what people don't talk about and what people don't emphasize as much is really understanding the industry that you're in. So I'll just give you an example. Most times the startup comes to us with a potential investment, a potential product at the very early stage, which is when we invest in them. Usually it's just an idea or maybe a prototype, but like you don't really know what your company is going to do at that point. So things can change very drastically. And we understand that as an investor, you know that you might have invested in a company that was targeting maybe cervical cancer, but then things change and then the company moves to breast cancer because that's just where the opportunity is even bigger or maybe makes more sense for the company. But I want to see an entrepreneur that one understands all of these dynamics, understands the industry and not just industry of cervical cancer, but really all of the use cases that maybe their device or product can be used for. So, for example, if you're talking to me about a device that you expect to be used in cervical cancer, have you done research on other use cases? So, like things like breast cancer or anything that is related. So, anything
Mm-hmm.
that's related to the particular industry, that is a very key component of me knowing if this is a backable person, because you have to think about the mindset of an investor when they're speaking to you at that point. Both of you don't know the future. Both of you are just saying, oh, this is probably something that could potentially work. But what gives an investor the confidence that, okay, I want to work with this person, is knowing that if things change, if and when things change, and when there's any kind of need for pivot or maybe a diversification, this person understands all of these dynamics and is going to be able to move very quickly, because that's the most important thing I think an early stage startup needs, the ability to move quickly, because we've seen a lot of companies that start out as something. Netflix is an example, Clubhouse is an example. Like, a lot of companies start out as something, and then all of a sudden you start to see the market changing, and then you have to move. So, like, are you going to be very quick to move? And the only reason why you be quick to move is because one, you understand a lot of the dynamics, and two, you're very adaptable. So those are the two skill set I think that you need to be able to demonstrate adaptability, and also demonstrate understanding and knowledge of the space where you're operating, in
Okay.
addition to, of course, having a good product, having a well thought out business model, commercialization plan, having the team, having the right people to work with you. These are all the things that are out there publicly, but I think these other two factors I mentioned are not very public because most people don't talk about that. But I think if you can demonstrate that, you give confidence to the investor speaking to you that, okay, of all of the remote monitoring devices, of all of the cervical cancer diagnostic devices, this is the one person I want to back, because I know that if anything happens, this person is going to be able to pivot very quickly or be able to change and adapt to the situation as fast as possible, because that's how the startup world operates.
All right, give thanks. So just to recap for that last question, so regardless of what it is your product is, if whether it's a service or an actual device, you have to be one, knowledgeable about the space that you're in. Two, adaptable. I would say, like, is it safe to say adaptable slash flexible? Like, because like you have to
Flexible is very important as well, because most times people come with a startup and this is their baby, right? And then telling the baby, someone with a baby, oh, you have to change, is very difficult to
yeah,
do. But so flexible is a very right word. Adaptability and flexibility is very important, because it's very difficult. Like, it's easy to say, but it's not as easy to do. And that's why once you have these two skill sets, then you can actually move beyond the pack, because once something is difficult, if you're able to develop that and train yourself to be that person, then you stand out from the pack of people that are trying to come up with a new device and trying to get investors to fund them.
right. Okay. Thank you so much, Chidi. That was so informative, and willingly, all of the listeners slash watchers will have learned something about investing in the public health space or investing in the healthcare space, and just investing in general. Both what to look for as an investor, and also as a organization or person looking for um, resources to sustain your own endeavors. So willingly, everyone, receive something from that, and you can also watch this over again if you need to.
Definitely, thank you so much for doing this. I think this information needs to be out there because most people think about public health and think of it in terms of charity. But there are people out there trying to prove that you can actually do charity and do philanthropic work at the same time as getting some kind of financial returns and also some kind of impact. And so, if we're able to blend all of this together, this leads to a sustainable model. So, like, you're not just donating to a company, but you're also donating to a company that will become sustainable. And these are all things that we believe are very important in public health, but are not talked about as much. So thank you so much for actually helping to drive this message. And I'm very happy to come up on the show the next time if more people have more focused questions. So thank you for having me.
Yes, thank you so much for joining us. So that is our show. Thank you for joining us on the newly crowned Masters of Health. And we will be back in the next couple of weeks with a different show and a different career spotlight. So thanks again. Peace, everyone, and be well.
Thank you. Bye.